Healing the Mind, Rational Emotive Behavior Therapy's Blueprint for Post-Traumatic Growth. Trauma, a labyrinth of experiences, casts long shadows on the human psyche. Post-traumatic stress disorder, PTSD, stands as an intricate consequence of trauma, affecting individuals in multifaceted ways. Rational Emotive Behavior Therapy, REBT, emerges as a guiding light, offering a comprehensive approach that unravels cognitive, behavioral, and emotive dimensions. This exploration delves into an extensive array of risk and protective factors associated with PTSD development, shedding light on the nuanced interventions that REBT employs. Risk factors for developing PTSD. 1. Trauma type and impersonality. The type of trauma and its impersonal nature, such as natural disasters or accidents, influence PTSD risk. Impersonal traumas may present unique challenges in processing and recovery. 2. Trauma frequency and duration. The frequency and prolonged exposure to traumatic events elevate the risk of PTSD. Chronic exposure or repeated instances compound the psychological impact. 3. Biological factors. Genetic predispositions and neurobiological responses to stress contribute to vulnerability. Biological factors interact with the nature of the trauma, influencing the likelihood of PTSD. 4. Peritraumatic dissociation. A dissociative response during or immediately after a traumatic event increases the risk of PTSD. Dissociation may disrupt the integration of the traumatic experience, leading to persistent distress. 5. Cognitive factors and distortions. Pre-existing cognitive vulnerabilities, including negative thinking patterns and distortions, contribute to the development and maintenance of PTSD symptoms. These cognitive factors shape the individual's interpretation of the traumatic event. 6. Childhood adversity. Adverse childhood experiences, such as abuse, neglect, or household dysfunction, heighten the vulnerability to PTSD. Early traumatic experiences may impact the individual's resilience. 7. Sociodemographic factors. Socioeconomic status, education level, and cultural factors influence PTSD risk. Disparities in access to resources and support systems can exacerbate vulnerability. 8. Personalization of trauma. The degree to which an individual internalizes the trauma as a personal assault influences PTSD risk. Personalized traumas often evoke intense emotional responses and may lead to persistent distress. Protective factors. 1. Transcendent values and moral compass. Embracing transcendent values and maintaining a moral compass serve as protective factors. Individuals who anchor themselves in values beyond the self often exhibit greater resilience in the face of trauma. 2. Positive coping strategies. Active coping mechanisms, such as problem solving, seeking social support, and embracing self-care practices, contribute to resilience. Positive coping strategies enhance the individual's ability to navigate the aftermath of trauma. 3. Sense of safety and control. A perceived sense of safety and personal control over one's life contributes to resilience. A belief in one's ability to influence outcomes fosters adaptive coping. 4. Exercise and physical well-being. Regular exercise and attention to physical well-being are protective against the development of PTSD. Physical activity has been linked to improved mood, reduced anxiety, and enhanced overall resilience. 5. Social support networks. Strong, positive social connections act as a shield against the full impact of trauma. Supportive relationships provide emotional validation and practical assistance during the recovery process. Interventions in REBT. 1. Cognitive restructuring. REBT employs the ABC model to identify and challenge irrational and unhelpful beliefs related to the trauma. Therapists guide individuals in restructuring inferences and beliefs to promote healthier perspectives. 2. Mindfulness and distress tolerance. Integrating mindfulness techniques enhances emotional regulation. Distress tolerance skills equip individuals to manage overwhelming emotions without resorting to harmful coping mechanisms. 3. Exposure therapy. Systematic desensitization involves gradual exposure to trauma-related stimuli. This approach may aid individuals in confronting and processing fears in a controlled and supportive environment. 4. Behavioral activation. Encouraging individuals to engage in positive and meaningful activities helps to counteract avoidance behaviors. Behavioral activation fosters a sense of accomplishment and pleasure, thereby raising dopamine levels. 5. Emotion regulation skills. Building emotion regulation skills involves identifying and managing intense emotions associated with trauma. Techniques include identifying emotions, challenging the dysfunctional beliefs causing them, and replacing the dysfunctional beliefs with functional beliefs, and developing healthier alternative helpful behaviors. 6. Reframing cognitive distortions. Therapists assist individuals in identifying and replacing irrational cognitions or sometimes refraining them when related to the traumatic event. This process helps shift negative thought patterns to more adaptive and realistic ones. 7. Empowerment and goal setting. REBT emphasizes empowering individuals to take an active role in their recovery. Setting realistic, achievable, approach goals and striving to achieve them fosters a sense of competence and greater control. Conclusion. In the intricate tapestry of trauma, understanding risk and protective factors is paramount. REBT, with its multifaceted interventions, not only acknowledges the complex interplay between cognition, behavior, and emotion but also tailors its approach to address the diverse nature of traumatic experiences. As we navigate the depths of trauma, embracing evidence-based approaches like REBT brings forth a profound understanding of healing and resilience.